Well, all has not been well in the medical sector for a while, despite all of the medical challenges that we're facing. We highlighted a few of them in the beginning part of this program. Talk about the outbreak of cholera in a number of states, in about 24 states. And you also talk about COVID-19, which we're yet to be really out of. However, despite all of that, our doctors, National Association of Resident Doctors, have been on strike for a while as a result of the refusal of the federal government to honor an agreement which is signed with them sometime in the past. Now, as a result of this, the umbrella body of doctors in the country, the Nigerian Medical Association, has decided to wade in. And in recent times, what we heard is that they had given the federal government a 21-day ultimatum to resolve the issues involving the affiliate members. Otherwise, well, some say the report was that they were going to go on strike, but it would seem that perhaps that was not the correct position. To shed a little more light on what exactly the NMA is saying, why it will seem it has handed down this 21-day ultimatum, what will happen at the end of this 21-day ultimatum, and whether or not we can afford for our doctors to, go on strike if that is going to be the action. We have with us this morning Dr. Ekpe Phillips, who is the Secretary General of the Nigerian Medical Association. Doctor, you're welcome to Sunrise Elite this morning.
Thank you very much.
Well, quite a lot going on in the health sector, troubling quite a few Nigerians because we thought, okay, when the doctors gave their warning strike, we thought, okay, in a few days this matters should be resolved. But as we speak, it's yet to see any concrete resolution. Rather, we've seen the federal government threaten to go to court. We've heard the president say, all matters concerning the doctors should be resolved out of court. However, there's very little progress reported in that regard. I don't know if you're part of the negotiation process. What is happening there?
Well, thank you very much. As you know, NAD, that is Nigerian Association of Resident Doctors, about 16,000 in the country. They are the engine room of the medical profession. That the first, second, third, and fourth level. What I mean is a house officer is part of resident doctors. A senior house officer is part of resident doctors. A registrar 2 is part of resident doctor. A registrar 1, 2 is a part of resident doctor. And these are the processes before you become a consultant. So that the engine room, if they are not working, the health system, especially in the public hospital, will be collapsed. Now, they've had some agreement with federal government. They signed what they call memorandum of understanding, which the federal government reneged, despite all the discussions. And then subsequently, they signed another agreement called memorandum of action. And this memorandum of action means that the actionable things, they discuss ways they're going to go about it. And of course, resident doctors called out their strike for the sake of Nigerians. Again, federal government reneged. Well, I don't want to go into who reneged or who didn't in terms of, is it the leadership? Is it the bottleneck? But, this is what is expected. They should do what they're supposed to do. So, because of this, first of all, NAD no longer trusts government to be able to do what they're supposed to do. And one thing that has been agreed between federal government and National Association of Resident Doctors is that their demand is legitimate. They deserve what they are demanding. And all these are geared into delivering a quality and affordable health care to our system. Now, they went on this strike on the 2nd of August. Government did not call them to negotiation table. Rather, what they did is to take them to National Industrial Court. On what basis? You are the person that it is now on your own court. Now that's called off their strike, you are the government, they are supposed to fulfill those things within the timelines that you discuss. And you didn't do that. And then you took them to National Industrial Court. It's akin to you are owing me. I'm asking you to pay me my debt. And then you take me to court. I'm not the one now taking you to court for not paying me. They are the one that took me to court for owing me. I don't understand. Do you understand what I'm saying? So it's really funny, and health should be considered as a very critical part of any nation. It should be a priority, and it's not something you play with. It's not something you begin to go to National Industrial Court and do negotiations. Let me tell you something. The ratio of doctors to patient in Nigeria is about 1 to about 6,000. And if you calculate it very well, it means that every doctor is doing the work of 60 doctors. They are tired, and that's why you see the brain drain occurring. So it's something that, and for every time, think about it, Nigerians are dying by the minute because the public hospitals are the hospitals that the poor man can access, the masses can access. The security man at your gate has a wife, and the wife is pregnant. He cannot afford a private clinic. It has to go to government hospital, and it's not functional right now because NAD is not working. Let's not deceive ourselves. The consultant alone can't do the job. It's not possible. It's just absolutely not possible.
Well, even the consultants were not happy at some point. The Medical and Dental Consultants Association of Nigeria, MDCAN, also...
Yes, they gave ultimatum. It is that their own is recent, so probably that is why when government discuss with them, say, okay, well, let's call it off and see what's going to happen. I'm afraid government may renege if cash not taken, so we are watching. Yeah.
So, I mean, but this 21-day ultimatum which the NMA has now issued government, what is it about?
Well, let me put it well. The wording we use was we placed federal government on notice. We didn't use the word ultimatum, but you explained it to be ultimatum. It's okay. But we are giving them 21 days before we react. 21 days before we take a decision.
To do what precisely?
Well, we are not interested much about what to do. We're interested in solving the problem. In short, it's like giving government 21 days latitude. These are problems they can solve within 1 week. You remember that on the 2nd of August, NAD went on strike. They had all that time to do something. What did they do? They went to National Industrial Court until NMA came in, and then we now started discussing and said we signed a memorandum of understanding. We are hoping that within that 21 days, the memorandum of understanding we signed would have been fulfilled so that NAD will call out their strike. We are not interested in the strike. We are more interested in fulfilling the demands of NAD. Because I'm telling you now that every minute a Nigerian is dying because of this strike. So it's like saying, let's assume that about 50 persons are dying every day. And you say 21 days. That is how many? 50 times 20, that's about 1,000. So you're saying we're giving Nigerians 21 days for 1,000 Nigerians to die. I mean, it's not acceptable. That's why we're not even thinking about it. What we are working now is to see how the demands of NAD are met so that they can call out the strike as soon as possible for the healthcare system to get back. People are dying.
So this 21 days is somewhat declared in solidarity with NAD.
Yeah, definitely. Well, before now, NMA has always supported NAD because NAD is an affiliate of NMA. It's part of us. We are aware. There's no time we say we're not aware of what is going on, But this is to let you know that, look, a bigger stake, we're weighing in now. I mean, NMA is involved all the doctors in Nigeria and in diaspora. And so by the time NMA is making a statement, it should be taken very seriously. That is the point we are saying. And of course, there's going to be an emergency delegate meeting at the end of 21 days if government have not acted. But I think they're acting. I believe they're acting. Because I've not been sleeping in the past 3-4 days, going around to making sure that these things are being fulfilled, that they're working on it. You understand? But at the end of that 21 days, if nothing has been done, we are going to call what they call emergency delegate meeting. And in that meeting, we are going to deliberate, look at what have been done and what have not been done. If it's not worth it, that meeting will take a decision.
What do you mean if it's not worth it? What does that mean?
I mean, for instance, you are owing me, let's say you're owing me 10,000 naira and then you pay me 100 naira. I mean, or let's assume they've not done anything. Do you understand what I'm saying? But I'm telling you that NMA is more interested in government doing something. We are optimistic and we believe that in a very short while, we should be able to achieve results. We've been going around and seeing the leaders of the health industry. I mean, 2 days back, we saw the Minister of Health. We saw the Minister of State for Health. We saw the Permanent Secretary for Health. And we saw the Minister of Labor and Employment. And of course, they are also worried too. And they also want the resident doctors to get back to work. And are working towards fulfilling those issues. Well, if I may tell you, part of the reasons why these things are not fulfilled are the bottlenecks. They are not putting the weavers as adequate as it's supposed to be. Health is an emergency. It is not a situation where you start pushing files. It's a situation where you make a phone call that the file is coming. Please get this thing done. Because somebody's life is at stake. That's what we're talking about. The bottlenecks and all the barriers have to be removed for things to move.
So, on government's part, I mean, we've been having these conversations over and over again, particularly in the light of the brain drain we witnessed. I mean, just sometime last week, right here in Abuja, we saw a 3-day recruitment happening in a prominent hotel right here in the Federal Capital Territory, and the idea was to take away our doctors. And this exercise happens, at least I'm aware of it, on a yearly basis. Even when we were in the middle of a pandemic where, you know, the country was on lockdown and nobody was going anywhere, the people who were still sought after were our medical personnel, and foreign governments, you know, found ways to to lure our doctors out of the country. So we understand the pressure in the sector. What I do not know is whether you're able to tell us from the conversations, from your interventions in the negotiations and what have you, what exactly does government say is the cog in the wheel of progress? Why is it so slow to addressing the issues? I mean, as you rightly pointed out, NAT went on strike on the 2nd of August. This is 1st of September 2021, and we're yet to see significant progress with them downing tolls, or even with them fulfilling that's government fulfilling its own terms of the agreement signed with them. From what you've seen so far, what exactly is holding government back?
Well, when you discuss with government, the first thing they will tell you that there is no money, that the country economy is poor, and that are living on loans. They keep borrowing money, that even in the supplementary budget, they are going to go and borrow money to fund the supplementary budget. Well, it is our country. We have to keep it going. People are working, they must be paid salary. So whether you are taking loan or you're not taking loan, it's not an issue. It is your mandate to create a good economy, such a way that you reduce the loan you take, at the same time, pay those who are working. The second thing we discovered was that there are a lot of obstacles within the system. You are going to a particular office and you're pushing a file, and by the time it gets to the office or the head of service, it takes some delays, and they want to do all due diligence and all the processes, which will take probably some 3, 4, 5 weeks or more. Then it moves to budget, it's delayed again. It moves to accountant general office, it's delayed again, and probably it gets to IP's delayed again. Also, all of a sudden, somebody can tell you, oh, hey, wait a minute, oh, this person is not adequately qualified. These are the issues. So at the end of the day, you find out that it appears as if they're not serious. And then when NAT calls out their strike, they slow down. Everybody go to sleep. And that is why you see that now NAT is saying, NMA, despite talking to us, we don't want to hear. You understand what I say? If not, they will listen to NMA. But NMA too, I've not even found the good reason. Government have not given NMA the good reason to tell NAT, please, can you call off the strike? They have not, because they've reneged. Look at all the lists. They've reneged in all these things. None of them we can say is well completed. Many of them are hanging, while some have not been attended to, while some are putting almost obstacles that appear to be impossible. However, looking at the brain drain, it shows the where we are. Naturally, human flight is normal. Migration and migration is normal, but with regard to healthcare workers, not just doctors. It's just that because that doctors are leaders of the health team, their own seem to be bogus. Nurses are also living in droves. Laboratory scientists are living. Pharmacists are living. And now doctors are living. These countries are smart. UK, US, Australia, Saudi Arabia. Because every country still needs doctor. They all need doctors, including US, including UK. The recommendation by WHO is 600 patients to one doctor. And now Nigeria have trained these doctors to be very good. Nigerian doctors are really indeed very, very good. They're sorted after. And that's why you see that Saudi Arabia, they've done their investigation, they've done their background check. And they realize, look, we need to take them if their country cannot offer them anything. And that is why you see they're enticing the doctors with powerful remuneration. They are living where you are working to a place where they're going to pay you about 20 times your salary, and they're giving you free accommodation. They pay your ticket to come in there, and they make you have a vacation and pay for your family. What else do you want? And they have all the equipment and the facilities. Don't get me wrong. Nigerian doctors are very patriotic. And that is why NAD is going on this strike. It's part of patriotism, to draw government attention, to say, hey, wait, you're not doing the right thing they're supposed to do. You understand what I'm trying to say? They are smart. Nigeria should be smart to change the system, to say what is going on. Have a roundtable and let's say we need to stop this brain drain. You know, think about it. Even the facilities we work, very poor facilities. It's not a place you're proud of. It's not a place you can tell your friend come and visit you. The workload is so much. I've just told you that one doctor is doing the work of 60 doctors in this country. Again, sorry, let me also tell you, there are a lot of doctors roaming the street of Nigeria without job. Meanwhile, we need them. Our primary health care is not, over 50% is not manned by doctors. The basic amenity is not there. Then, what you and I know, insecurity is a huge reason, a very big reason why there is brain drain. The problems are much. We need to sit down in this country and do nation building. We are just sitting down on auto cruise, nothing is going on. We don't even know where we're heading to. And so a doctor is quite intelligent to begin to project what happens to this country in the next 5 years, in the next 10 years. It seems we are having a nosedive. Because when last did you hear from the news a good news from this country? Look at the cost of dollar. Dollar is costing over 500 naira, and we need to buy medical equipment. We don't manufacture them here.
So what I'm actually very concerned about is whether or not, these are the facts. In terms of the fact that we have doctors who are not employed, despite the fact that we don't have enough.
Very true. Let me tell you something. They brought what you call central posting for house officers.
Yes.
A medical graduate to graduate and wait sometimes up to 1 year before he gets his space.
So what I want to know...
A doctor who has finished housemanship and finished NYSC writes for an exam called primaries because he wants to progress in his career. And he waits 1, 2, 3 years looking for space to start residency training. And since there is no space, what do you expect him to do? When UK is offering a place, PLAB is so easy to pass. So
it's not that there is no space. What we understand is that the spaces in the federal institutions are saturated.
They are not saturated, ma.
Oh, okay.
Let me explain to you.
I'll let you explain that point. Yes. But what I want you to take up for us is what is happening at the state level, because we understand that a lot of the letting the ball down, the weak link are the states.
Yes, I will explain that. As you know, the states are independent. They fund their economy. They take care of the hospitals there. First, the states are also not employing. They are leaving the work, majority of the work, for the federal government. You find out that they have federal government institutions in the states. And the doctors in those federal government institutions is much more than what the states are employing. It's bad enough. The states are not paying. I will tell you, for instance, Abia State is owing some of them 19 months, some of them 16 months, some of them 10 months. How can one live like that? It's not like these doctors have something else they're doing. You can imagine that you are a doctor, it's time for your children to go back to school, you cannot even afford it, they are borrowing money even to feed. Is it not enough to leave the country? Another state is Imo State, under the same line. Another state is Anambra State. Then you have Ondo State. Then you have Ekiti State, where you have the chairman of the Governors Forum. We have visited him, we discussed with him, and he said he was going to take it up. But we are still at the same point. So, NAD have to come and rescue his members. The job of NAD is majorly welfare of his members. And these doctors in this state are members of NAD.
So how are we taking up this conversation with the state?
Well, we have discussed with the Minister of Labour and Employment. He has mentioned that health is not even in the concurrent list, rather it is in the residual list. And therefore, they don't have so much influence. They can't do much about it rather than to talk to the governors, maybe through the Governors Forum and all the rest of them. I think that is what the only thing they said they are going to do. But remember, there are states that are doing what they're supposed to do. Why we believe that something is wrong with this particular state is that there is no state in the north that is having the same problem. All the states in the north are paying as of when due. They are not owing their doctors. Lagos State is not owing. Delta State is not owing. Cross River State is no longer owing. Akwa Ibom State is not owing. River State is not owing. And some of these states have more money. That is, I'm talking about Abia State, Imo State, Anambra State, Ekiti State, and Ondo State have more money than these other states that are meeting up. So it just shows that the leadership of those states are insensitive to the health of the people. because these are the people who are treating your relatives. Not, I mean, it may not be their immediate family because they have all what it takes to go to a private hospital and to also travel out. But how about the rest of the persons who voted them in?
The questions. Let me take this to my colleague, my colleagues in Lagos. Kaede.
Well, thank you, Mark. We, as usual, needed to have a robust conversation. So just to put it out there, we reached out to the Ministry of Labour and invited them for this conversation so we can hear the different sides. Then we're directed to the Ministry of Health from the Ministry of Labour. We, of course, reached out, invited them, sent a message, called. But as you can see, we don't have representation from the government. And we're really hoping to deal with these issues. It's been a month of a strike. But Dr. Phillips, I'd like to read this statement by the Minister of Labour for you and get your response. It's a part of some things he said recently, saying that doctors should ask themselves questions. Why is it that when your colleagues are in government, you go on the greatest number of strikes? Goes on to say some of these colleagues were presidents, secretary generals of NMA, and even president and secretary generals of the National Association of Resident Doctors. So he mentioned Dr. Chukwu, Dr. Isaac Adewale, who faced plenty of strikes. And he says since this government came, he has consolidated 4 strikes. Now, this is how I'm going to end the excerpt I'm taking from his statement. He went on to say, something is wrong. We need to ask ourselves some questions and be straightforward with the answers. I'm not sure if the NMA and perhaps the resident doctors have had a chance to respond to this particular inquiry, if I may, of the minister.
Well, what I found out is, I think it's the same theory where you have a friend, 2 of you are very close. I mean, then the next moment he's having a political appointment, and then the next time you're calling him, his phone is not going through. The same thing, these were members of Nigerian Medical Association or the C members, but we immediately get into government, they seem to play their boss bill. I mean, they seem to be on the government side. They seem to have forgotten that they were doctors first. It's not because they're doctors. I mean, it doesn't even add up. There's no logic about it that because you're a doctor, that is why we want to go on strike. No, it's not that. The fact is that we expected that they will even understand more, and that they will even prevent the ability for strike because they're able to go to their principals to say, explain to them. They have the opportunity. The ministers have the opportunity of getting to the federal government, getting to the president, and explaining well compared to somebody who is not a doctor. But unfortunately, they're not doing a good job because I think they're not doing a good job because it shouldn't happen. In short, the more reason why it should not happen. The doctors are not going on strike unnecessarily. That is how I can answer it. I think that probably the fault is theirs. They have not looked at it critically to say, what do we do to prevent this going on strike? How do we solve these issues that are demanding? For instance, look at it on the 2nd of August, NAD went on strike, and there was no negotiation until they went to industrial court without thinking about the implication of NAD not going on strike, the number of deaths, the number of mortalities, the number of morbidities. I mean, so it's just unfortunate because
so Dr. Phillips, I'd like to
that because they're supposed to be round peg in round hole.
I mean, and that takes me to my next question as we wind down on this in about 2 minutes.
To fulfill these issues before they are demanded.
Right. So this takes me to my next question, Dr. Phillips. If you can hear me, pardon me, we're rounding off in about 2 minutes. But I need to raise this. I know there's been that debate over it is right to have professionals, doctors as administrators at different levels, or just have a core administrator who can administrate, for lack of a better term, things. So don't you think that with this whole, having a doctor as a minister and all doesn't really guarantee that you have smooth operations of a ministry? Don't you think that then lends credence to that side of the debate that says just have a core administrator, someone who knows administration quite well, doesn't have to be a professional in that field to be at the helm of affairs?
Well, you've just said that, but I will tell you, if you go that way, probably the problem will get worse because, I mean, there are research and publications that show that doctors are better manager for health institutions, for health organizations, and the rest of them. It's just that, I mean, Nigeria is not just getting it right, not just in medicine, but in many other places. There are a lot of confounding variables that you need to put together for us to work properly. So, I mean, making that statement that because doctors have been there and it's not working is wrong, because even when some few non-doctors were there, it got worse. But remember to Professor Nico Ransom-Kuti, when he was the health minister, he did marvelously and perfectly very well. I know why. Because for once, the president of the country, or the head of state at that time, he told him that, please give me a free hand to work. And he said, I'm going to give you a free hand to work. And because he had the free hand to work, he was able to deliver. But now these ones don't have free hand to work. They have the knowledge, they have the capacity, but the issue is that there is politics in it. They are politicians, I mean, and they have to also look at other issues, you know. So
the 21-day ultimatum, when does it expire?
Well, give or take, we're looking about 18th
of September.
Yes.
And
but we are also looking at, we may never really get there. We are really working hard. I think that's where I wanted to cone it down on. You see, each time people keep talking about 21-day ultimatum, I'm not happy, because we should think about using this media to advise government that people are dying by the day, that this strike should have been called off yesterday, and therefore government should act. I mean, we are so excited about 21 days. No, we don't want 21 days. We don't even want to get there. So most questions that comes, oh, what next 21 days? What next when 1,000 persons dies? I don't want to get to that point.
I don't think any Nigerian really wants to get to that point.
Yes.
So we sincerely hope that something will happen before the 18th of this month.
Yes.
We have to thank you.
If nothing happens before the 18th of this month, if nothing happens before that 21 days, government should be blamed. That means they don't care for Nigerians. People are dying. I'm telling you, I'm a clinician. I work in the clinic. I know what is going on. It's not like being an administrator where you are not working, you don't even see the deaths. You know, the administrators right now are not seeing the deaths. The government people they are not seeing it. But go and ask the nurses who are working in the hospital. Go and ask the people. You will see that now people are going to traditional bed attendants to take deliveries, and it's going to be a huge problem.
Sorry, Dr. Phillips, we're totally out of time. I want to believe that those who are responsible and should be responsible to ensure that we do not get to the 21 days are watching and are listening to the appeal of the NMA on this program. We have to thank you for sharing your thoughts this morning with us, and for being as patriotic as you are with the situation on the ground. Thank you so much for coming on our program this morning. Dr. Ekwe Phillips is the Secretary General of the Nigerian Medical Association. We'll take a break now. We'll come back with another matter for you. Please stay with us.